I'm your nurse this afternoon. My name's Brandy. I've been a nurse here for about 8 years. And today we're just going to do an assessment of your ears, nose, throat, and mouth. And I'm going to be videoing it for school, if that's all right with you.
That's fine.
Okay. Could you tell me your full name?
Courtney Williams,
Okay, and your date of birth?
2689.
And could you tell me where you're at?
Carolina's facility,
And could you tell me who the president is?
Obama.
Okay, great. So what I'm going to do, I'm just going to shut the door for privacy. Okay, and so we've already gotten your history. You do get an annual physical exam. You get your flu shot every year. You had strep throat a few months ago. You took some antibiotics, and that's cleared. And then you don't exercise regularly, but on occasion. And you try to eat a good diet, good healthy diet. So I'm going to go ahead and open the blinds and allow some natural light to come in. And I'm also going to wash my hands. Alright, and for this assessment, sitting up on the bed is fine. There's no need to change into a gown for this assessment. You can keep your clothes on. What I'm going to do is get your height and weight. How tall are you?
About 5'5".
Okay, good. So if you'll slip your shoes off, I'm going to have you lie flat and we're going to get your weight. All right, 125. And now I'm going to check your blood pressure, your heart rate, and your temperature. Okay, good. Your temperature is 98.1. Your blood pressure is 105/62, and your heart rate is 64. And I'm just going to grab some gloves, and we're going to start the rest of the assessment. Now, Miss Williams, could you take your glasses off for me?
Yeah.
Thank you. Now, I'm going to start by just looking at your nose. I'm going to check for symmetry. I'm going to also feel for it. I'm going to make sure there's no type of inflammation. Okay, good. Then I'm going to have you close off each nostril and inhale to make sure both nostrils are patent. So if you'll start with your left nostril, and could you inhale for me? Very good. And the other side? Okay, great. Thank you. Now I'm going to take a look in your nose. I'm going to be looking to make sure everything's nice and smooth, that there's no drainage, that the turbinates are red, and there's no swelling there. Now I'm going to have you just look straight forward. I'm just going to lift the tip of your nose to insert the speculum. Okay, and then I'm just going to have you tilt your head back, and I'm going to do the same thing. am going to take a look at your lips. I'm going to make sure there's no swelling. Everything's nice and smooth and moist on the outside as well on the inside. So I'm just going to pull your lips out one at a time to make sure everything looks okay on the inside. Alright. Nice and smooth and pink. Good. Moist. Alright, now I'm going to just take a look at your teeth and gums. Now, do you get regular dental exams?
I do.
Okay. I'm just going to make sure there's no missing or broken teeth. Make sure the gums are not swollen or red. I'm going to count your teeth. So if you'll let me take a look. Alright, 32 teeth. Everything looks okay there. No issues. Now I'm just going to take a look at your tongue. I'm going to look to make sure everything's smooth, pink, no lesions, white patches. Then I'm going to swing it to each side so I can get a good visual of each side of your tongue for the same reason. So if you'll just stick your tongue out for me. Alright, nice and smooth and moist. Good. And I'm going to swing it to the sides. Okay, great. Now, I'm going to take a look under your tongue. I need you to put your tongue to the roof of your mouth. And here I'm just looking to make sure everything's nice and smooth and moist. I can see the veins. Good. No lesions or patches. Very good. Next, I'm just going to take a look inside your cheeks and look at the little ducts that you have near your second molar. I'm looking for the same thing, making sure everything's smooth and pink, no lesions. And I'll take a look at that duct there. Good. All right, everything looks really good. Let me check this duct. Good. No areas of concern there. Next, I'm just going to shine a light and look at the roof of your mouth. Make sure everything looks normal there. Very good. Yeah. Okay, and then I'm going to look at your uvula in the back of your throat. I'm going to have you say, ah. Ah, I'm going to make sure the uvula rises as well as that palate in the top of your mouth to make sure they rise evenly. And then I'm going to use the tongue depressor and take a good look at the back of your throat to make sure everything's nice and pink, no redness, drainage, lesions, or white patches, which come with strep throat. I want to make sure your tonsils aren't inflamed and that they're a good size. So we'll start by looking here at your uvula. So if you'll stick your tongue out for me, I'm just going to depress it a little bit and say ah for me.
Ah.
All right, and now I'm going to visualize the back of your throat here. I'm going to use my light. Your tonsils look like a +1, meaning they're not swollen at all. No signs of white patches or inflammation. All right, now we're going to move on to your ears. I'm just going to take a peek at the outside of your ears, making sure they're symmetrical, making sure the color's okay, and then I'm going to just palpate or feel your ears to make sure there's no tenderness. There's a bone right behind your ear called the mastoid process. I'm going to make sure there's no tenderness there, as well as the little piece of flesh here in front of your eardrum, make sure that's not tender. So, any tenderness here on the pinna of your ear? No?
No.
And here on the mastoid process?
No.
Okay. And then any tenderness here?
No.
Okay, very good. Next, I'm just going to take a look inside your ear with the otoscope. What I'm looking for, I'm looking at that canal to make sure there's no redness or inflammation or drainage. I'm also going to be looking at the eardrum to make sure it's nice and flat, not bulging, a nice pearly gray color, and transparent. So I'm going to start by looking with your left ear, so I'm going to have you turn your head to the right. And let me grab another cap for it. Alright. So when I insert this into your ear, I'm going to be pulling your ear up and back.
Okay.
So if you'll just turn your head for me. Very good. I don't see any drainage or redness in that canal. The eardrum's nice and flat and gray. Alright, so I'm just going to have you turn your head to the opposite side. I'm going to pull your ear up and back. Take a peek inside there. Ear canal looks good and clear. There's no signs of inflammation, no redness or drainage. The eardrum's nice, flat, pearly gray, transparent. Very good. Okay, next I'm going to do what is called a whisper test. So what I'm going to have you do is close off one of your ears. I'm going to go to the other side about 2 feet away and whisper a series of letters and numbers and get you to repeat those to me, and then we'll do the other side. So if you'll stick your finger in your right ear, I'm going to come to your left side and whisper 4BF. 4BF. Very good. Now I'm going to come to your other side, and I'm going to say a series of letters and numbers, and I'm going to get you to repeat them.
GN4.
Okay, very good. Next, I'm going to have you slip your shoes on for me. And we're going to do and stand, thank you. We're going to do a test for your inner ear. And there's something inside your inner ear called the vestibular apparatus. And we're going to do a test that kind of tests to make sure everything's working okay in that inner ear. So I'm going to have you stand straight with your arms at your sides. And in a second, I'm going to ask you to close your eyes for about 20 seconds. And I'll stand next to you in case you get unsteady. And that will kind of determine, that helps with balance. So it'll make sure that part of your ear is intact.
Okay.
So if you'll close your eyes for me, I'll stand next to you. And for about 20 seconds, we'll make sure that you're able to stand here. All right, very good. You can have a seat. Now, Miss Williams, I did not really have any findings that I'm concerned about. Nothing significant. Everything looks healthy to me. No signs of infection or anything like that. What I am going to say is you do need to try to exercise more routine 3 to 4 times a week. And continue with a healthy diet. With a family history of hypertension, you do need to watch your diet and exercise because that's going to prevent heart disease. Also, the way it's been really hot, I want to make sure you're getting your fluids. You should normally drink 8-ounce glasses of water a day, and especially in this heat, make sure you stay hydrated. Your blood pressure was, it couldn't afford to drop too much, so just make sure you're staying hydrated. Any questions for me?
I don't think so.
Alrighty. Well, thank you so much for your time.
Thank you.